So this is Module 3, Ultrasound Terminology. I'm just going to warn you, there's a lot of definitions in this module and some wordy slides, so just bear with me. There are going to be some pictures at the end. Just a note, MSK ultrasound is only ever as good as the practical skill level of the person that's doing it and the clinical reasoning ability of the clinician. Upon completion of this module, the student will be able to explain basic ultrasound terminology related to real-time ultrasound, transducers, echoes, and artifacts, describe the difference between various types of transducers and ways to move them during the ultrasound procedure, differentiate between hypoechoic, hyperechoic, and anechoic structures on real-time ultrasound, and define an artifact and recognize possible reasons they may arise on ultrasound. So let's start with some terminology. Ultrasound is a high-frequency acoustic oscillation that travels from the probe through the gel and into the body. So the probe then collects these sound waves that bounce back, and the computer uses them to create an image on the screen. So it creates this image based on loudness, which is amplitude, pitch, which is frequency, and the time it takes for the signal to return back to the transducer. And what type of body structure and tissue the sound is traveling through also helps create this image. Real-time ultrasound imaging, or RTUS, is the rapid sequential display of these ultrasound images, resulting in a moving presentation. So while you move the transducer, while the tissues move, you can see it on the screen. So this is field of view. Field of view, you can either have the short axis or transverse view, or the long axis or longitudinal view. So if you look at these bananas, that's the best way to kind of explain them and picture them in your head. So if we're looking at the long axis or the longitudinal view, this is taken in line with that axis of the structure or parallel to the structure. So it's like a banana that's cut long ways. The short axis or transverse view is the cross-sectional view of the structure or tissue, and it is taken transversely to its long axis. So that's like cutting the banana the short way. And on the other picture, it shows how the median nerve would look in both axes. So the short axis is going to be the median nerve right here on this slide, and this is the cross-sectional view, and that's what we're going to be measuring. On the right, this is the long or longitudinal view, and you can see the difference. We are now going to talk about transducers. Two important aspects to consider when establishing transducer positioning are the transducer marker and the incidence angle. So a transducer probe is the crystal which converts electrical to sound energy. For MSK ultrasound, there are two primary transducers, the linear array and the curvilinear, convex, or curved array. An ultrasound transducer is referred to by their operating frequency, and it will say it on the transducer usually. A transducer probe marker or notch. The probe usually has a notch, bump, or light that corresponds to a logo or dot on the top left of the ultrasound screen. This serves as a directional marker. It assists with anatomical orientation of the image. So in the middle image, we have the light right here, which is the probe marker or transducer marker, and then that corresponds with this image right here, which is like a red E. I don't know if you can see it on the left of the ultrasound screen. To the left, this is the probe that you will use during your lab or practical component. And right here, I have three of the different types of the ultrasound probes. We're going to continue talking about transducers. The incidence angle is the angle between the sound coming from the transducer and a line perpendicular to the boundary of the medium. This just means that the more perpendicular to the target structure, the better quality ultrasound you're going to get. So the whole goal of ultrasound is trying to get as perpendicular as possible to the structure you're trying to view on the screen. There's a couple ways to do this. So you have the heel-toe maneuver, which is when the transducer is rocked or angled along the long axis of the transducer. This is shown in figure A right here. Then you have the toggle maneuver right here. This is when the transducer is angled from side to side. And I have a little sample video for you guys as well. Okay, another, yeah. Okay, now we're going to talk about echoes. So when you're talking about echoes, the definition, you have to know the definition of gain. Gain is the amplification of echoes returning back from the tissue to the transducer. So like I said, remember the sound waves hit the tissue and then they come back to the transducer, and that's how the image is made. So when you're talking about gain, the degree of amplification is under voluntary control of the operator. So the brightness of the image can be adjusted to ensure that the dark hypoechoic objects such as blood and urine are black on the screen, and the bright hyperechoic objects such as bone appear white on the screen. So in MSK ultrasound, the gain is adjusted to ensure that you have bright white cortical bone. And when you're talking about echogenic, that's the way that the ultrasound wave is reflected back to the transducer. So a structure or material that produces an echo, which is the reflection of the ultrasound waves. So the more echogenic a structure or substance is, the brighter it will appear within the ultrasound image. And we're going to kind of go into that a little bit more on the next slide. Now I'm going to talk about the echoes produced by various tissues. Hypoechoic is a region in which echoes are noticeably of a lower amplitude than those of the surrounding structures. That means that they're giving off fewer echoes back to the transducer, and the tissue or structures that reflect relatively few of the ultrasound waves directed at them. So all of these tissues will appear dark on the ultrasound machine. Because they're not reflecting those sound waves back. Hyperechoic is a region in which echoes are noticeably of a higher amplitude than those of the surrounding structures. So they're giving off more echoes back to the transducer. The tissues or structures will reflect relatively more of the ultrasound waves directed at them. These tissues will appear bright on the ultrasound machine. Anechoic is a region that appears echo-free, or without echoes, on the sonographic images. These are tissues that do not reflect any waves back to the transducer. So a clear cyst appears anechoic. These tissues will appear black on the screen. Next, I'm going to show some examples of echoes. This first image, you have a hyperechoic structure, a hypoechoic structure, and then the anechoic structure. Now, if you look at the part of the image that has the red arrow pointing to it, I'm going to give you a few seconds to look at this example and see which type of echo you think it is. If you said hyperechoic, you are correct. I have a few more examples for you. So again, looking at the red arrow, what structure would you say this looks like? If you said hypoechoic, you are correct. Last one, looking at the red arrow, which one would you say this is? You said anechoic, you are correct. We are now going to talk about artifacts. An artifact is an incorrect representation of anatomy or motion, situations that result in structures that are not real, missing, improperly located, or of inaccurate brightness, shape, or size. It's very important to know about artifacts. There are a lot of them, and I just put down some of the most common ones, but you need to know what the structure should look like on an ultrasound image, and you have to know about some of these artifacts. Some of them can be corrected and some can't, but if you don't know what it is that you're supposed to be looking at, it can affect the ultrasound image and then possibly how you diagnose something. So first you have acoustic shadowing. This is when the ultrasound waves encounter a structure that has a high attenuation coefficient. So the most common one is ribs, bones, gallstones, and the image to the right shows a gallstone shadowing artifact. Then you have posterior acoustic shadowing. This is the opposite of acoustic shadowing. This is when an ultrasound wave passes through a structure with significantly low attenuation, such as blood or fluid-filled structures. So these are most common in the bladder, gallbladder, cysts, and vessels. And you have a picture of the shadowing on the right. Then you have edge shadowing. This is refraction. So an ultrasound wave are deflected from their original path when they encounter curved or smooth-walled structures. This will result in a shadow-like line that comes off the structure on the edge. So this is most common in vessel walls, gallbladders, cystic structures, and the aorta. The image on the right highlights the edge artifact that's shown on the internal carotid artery. These are some other artifacts that you can have. The focal zone artifact. This one can be corrected. So I'm going to show you. In this image right here, the deep radial nerve is blurred, and it becomes clearer in this image when the focus, this yellow arrowhead right here, has been set at the same depth as the nerve. So you can see in this image it's a little bit blurry, and that's because the arrowhead is pointing all the way up here. But in the second image, the arrowhead is at the same depth as the nerve. This is very important when you're looking at an image. You want to make sure that the arrowhead is at the same depth as your target structure. Anisotropy is the next artifact, and it's the most common. This one can also be corrected. This one has to do with the incidence angle. So it's the angle of the transducer in relation to the target structure. If the ultrasound beam is not perpendicular to the target, the signals will be reflected away from the transducer, making the target look hypoechoic, even though it's not. In the picture to the right, you can see right here, this one looks hypoechoic when it really is hyperechoic. So this is most common in tendons and ligaments, but you can also see it in nerves. Reverberation is the last artifact that I have for you. So in the presence of highly reflective structures, echoes may reflect back and forth between this structure and the ultrasound probe, and it makes these like A-lines is what they're called. So it makes like all these lines, and this can cause the ultrasound screen to record and display multiple echoes on the screen. And a picture on the right kind of shows an example of that. So here are some examples of artifacts. Same thing as before. I'm going to give you a couple seconds to look, and then you can tell me which artifact it is. The first one, if you look at the first image and then the second image, it's the same structure, and this artifact is formed with transducer movement. Anisotropy is the correct answer. Next one. So when you're looking at the artifact, it's going to be the starred parts of the image. And if you said edge shadowing, then you are correct. Last one, if you're looking at the median nerve, labeled M and circled in red, the other part of the image is also circled in red that I want you to look at. What artifact can this lead to? If you said focal zone artifact, then you are correct because the arrowhead is not at the same depth as the median nerve, and it can change how the median nerve looks. This is an example of anisotropy in a video, and we purposely made this happen with the carpal tunnel. So this is all created, all of these changes in the ultrasound image were just created by changing the transducer and making it perpendicular to the structures of the carpal tunnel, and then changing it so that it wasn't perpendicular anymore. So the main point is, how do I avoid these artifacts? Some of these can be reduced by adjusting the transducer position and or the machine settings, and you need to be aware of their mechanisms because they can lead to diagnoses that are not correct. Prompt recognition of these artifacts will contribute to more accurate and easier diagnoses and interventions alike. So you want to position the transducer beam so that it is perpendicular to the structure being examined. If the structure is curved, then you will need to continually reposition along the structure to exclude anisotropy and other artifacts that can cause hypoechoic tissue. The examiner does not want to make the mistake of assessing normal hyperechoic structure as hypoechoic when it is due to just the transducer beam and the orientation resulting in that artifact. You want to make sure that your settings are optimal for the target tissue you are viewing, so focusing focus, depth, brightness, etc. And here's some references. Okay, now it is time to check your understanding. So if you would go to the module quizzes tab on the website and take the quiz for module 3, then you can get on to the other modules.